Hi everyone, thank you for inviting me to the Philippine Digital Medicine Conference, and I'm here to talk about how do we actually protect ourselves when we are online. I'll just share my screen there. So, how to protect yourself and your practice as a digital medicine practitioner. We all know that after the pandemic, we were all shifted in a telemedicine platform. And as we all know, nothing can still replace a face to face consult. But here are some tips that I can share in terms of how we can get ourselves protected. Just a disclosure, I am an occupational medicine specialist. I'm the head of the Makati Med Wellness Center, and I have no financial disclosure or conflicts of interest with the material in this presentation. Okay, when we talk about digital medicine, we're talking about three factors that is involved. Number one is privacy and confidentiality breaches. Number two, yes, there is still risk of misdiagnosis since we really cannot examine fully when we are online. And lastly, data rights. So, tip number one, alam ko naman lahat tayo we're already familiar with the term consent. So always ensure that we get informed consent, both written and verbal, from our patients. And what does this informed consent contain? It informs possible risk. Ito, napaka-importante, yung limitations of telemedicine. And of course, wag din natin kakalimutan yung benefits ng digital health tulad ng we can monitor on a more daily basis or weekly, walang traffic, etc. Something like that. So, may benefit rin naman nun. And engage in possible alternatives if the client is still hesitant on digital health platforms. I have encountered patients before that are more comfortable on the phone. But of course, I had to explain it's more difficult. And then I also had to ask consent. Meron ding iba na gusto nila off-cam. But ina-assess ko kung pwede ba off-cam yung kanilang concern. So something like that. It's really parang ipa-fine-tune natin accordingly. Inform clients of the evidence. Now, take time to brief our patients on the evidence that supports uh, not naman exactly the accuracy, but more of the practice of new technology when it comes to medicine. And be transparent on the limitations of evidence and what areas are yet to be studied, and avoid providing false reassurances. Scrutinize the technology also. Validate the accuracy of the products and services that we are using. I know we all use different platforms, and so we try to weigh its pros and cons on how we use it. My number one, of course, my number one my criteria is data privacy. Number two is ease of use. Kasi parang ang toxic na ng um, computer eh. So it has to be something that is user friendly. So that's one of my criteria. And also review the context and results of clinical trials conducted while doing telemedicine or digital medicine, and check how the data is governed, protected, and how data rights of clients are respected. So that's very important. Now, in validating products and services, there are three things that we must do: validate, check, and avoid. So, when you say validate, again, as mentioned earlier, if it's already approved for public use, check if the products are recommended by professional organizations. Although I know our professional organizations are giving us free hand on what to use, just para lang, pero make sure lang data privacy is ensured, and avoid advocating for the use of therapeutics and devices that have no explicit approval, lalo na kapag that is technology oriented. Now, hindi natin maiiwasan that sometimes there may be some breaches, no? Personally, wala pa naman, knock on wood. But make sure that you also implement emergency plan for breaches. So be upfront when it comes to the security threats and breaches that are encountered, and constantly communicate what is being done to allay anxiety and what steps they can do to secure their data. So madami yan. Some platforms have two-step verification processes. Please do use that because it kind of safeguards kasi that's patient data eh. And when doing telemedicine, we will enter patient data for EMRs, electronic medical records. And so we have to really be careful about data breaches and know when to refer. I know that telemedicine, digital medicine is about one-on-one or maybe even one to family, but there are really some health conditions that may need referral from other specialists or laboratory and procedures. Just a reminder that there are specialists who actually practice telemedicine and know when to refer a patient. So that ends my short talk on how to protect ourselves in this world that is using technology. And I think the future of medicine really is a hybrid combination between telemedicine and face-to-face consultations. So I hope you all learned from a short thing or two. And again, congratulations to the Philippine Digital Medicine Society for holding this virtual conference. And I hope to see all of you in person when all this is over. Salamat po.